3 minutes. Speak to the board. Speak, please. Oh, my goodness.
Good morning, everyone. I'll call to order the Wednesday, October 9th, 2019 meeting of the Board of County Commissioners. Will you please join in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you and welcome, everyone. This is the time we have for citizen input. Rhonda, are you wanting to give citizen input this morning? I saw you grab a blue form, but if you've got something, you can fill out the form after give your input if you'd like. Got 3 minutes to.
He's a regular.
Yep.
Won't speak to the audience.
Yep.
I would just like to ask for your consideration. I'm Ron, aka Rondo. I didn't mean to make it sound like an accusation a couple weeks ago when I talked about homeless issues, but we have them and we have solutions. So what I would like is for you guys to reach out to the Homeless Leadership Coalition that meets once a month at the downtown library on the first Friday of every month, and ask that conversation to be brought here and have them have their monthly meetings here. And that would be awesome for you guys to make that move. It'll say something about you guys. Thank you.
Thank you, Rhonda.
And just to follow up with that, we actually, I know Eric attends regularly, our deputy administrator, and we also, on our agenda today, we are going to have a report at the end of the meeting from our behavioral health services about what we are doing. We have someone who's actually designated that works totally in that, so you'll hear about that some today at the end of the meeting. It's the last action item. Any other citizen input? Seeing none, we'll move on to the consent agenda. Commissioner DeBone asked we maybe pull items number 3 and 4 so we have a short discussion about those appointments and what that board is, the Upper Deschutes Watershed Council. So we'll pull those 2 items. Anything else, Commissioner Dare?
No, I just want to thank Summers, Sears, and Jody Birch for joining the audit committee.
Okay. When's your next audit meeting?
It'll be in December.
Okay.
It's quarterly.
So now we have a full committee.
Yes, we do.
Good. All right. Any other items to pull? Okay. Let's seek motions.
I move we approve the consent agenda with the exception of items number 3 and 4 today, October 9th, 2009.
And I will second it.
Okay. Further discussion? And this is, we're also approving some limited duration or some public health modernization items that we've discussed before on this. So, Commissioner Adair?
Yes.
Commissioner DeBone?
Yes.
And the chair votes yes. So that means our first action item, we're going to talk briefly about items number 3 and 4. We've got reappointments of 3 people to the Upper Deschutes Watershed Council. And then looks like the resignation of 3 people from that council. So we're going to have a little report. That is a Deschutes County ordained agency, I guess, in the sense that we have an ordinance that creates it. So.
Yeah, just as quick background, watershed councils were created. There was a House Bill 3441 in 1996 that led to the creation of local watershed councils. The Upper Deschutes Watershed Council was formed in 1997. Their mission is to seek to protect and restore the 2 million acre Upper Deschutes River watershed through collaborative projects in habitat restoration, watershed education, and long-term monitoring. They have a list of projects that are related to river restoration, monitoring, and education. I know they work closely with our schools to educate children. They go out and do field tests on the rivers and streams. Usually once a year they come in and update the board on their projects. And they're considered a service partner of the county, and they take the Deschutes County funds and use that to leverage grants and federal funds to restore the waterway, the rivers. I know that there was a project at Deschutes Creek where they restored the original flow of the river and purchased a whole bunch of native vegetation from local nurseries for that, and so they work on all kinds of projects like that.
Yep, and just taking a moment for us to kind of think through that instead of just having it slide through in the consent agenda. Habitat Conservation Plan is a big document that's coming out in partnership with all the water users and the visions of what a natural stream flow would be. So these are folks that are very focused on in this area. So do want to send thanks out to Susan Butterfield, Chuck Arnold, and Danielle McBain for their service in the past, and reappointing these other folks, Jason Gritzner, Joanne Richer, and Ted Wise for this Watershed Council. So as I say, we don't talk about it a lot. We do have them come in maybe annually and kind of talk about their project list. So that was my only goal, is just to take a moment, acknowledge what's going on there. Good partnership in the health of our Upper Deschutes watershed.
Sure, Darren.
I believe Chris spoke to our group just recently, right after he'd taken this position. So, yes, we're aware of the education that they do provide to the community. It is outstanding. So I appreciate that.
Yeah, so with that, I'll move items number 3 and 4, the consideration of board signatures for reappointment and board signature of letters thanking those members mentioned.
I'll second it.
Okay. Commissioner DeBonne?
Yes.
Commissioner Dare?
Yes.
And chair votes yes.
Great.
Good, thank you. We'll move on to action item number 7, consideration of chair signature of document number 2019-749, notice of intent to award letter to Kelcon for Stabilization Center remodel. Morning.
Holly Harris, Program Manager, Health Services.
Lee Randall, Facilities Director.
Good morning.
Morning.
So we had a publicly advertised hard bid process and open bids for the remodel of the existing programs building into the Stabilization Center. And the bid results are provided for you. The low responsive bidder was Kelcon from here in Bend, and at $998,000 as the base bid. Next higher was Griffin Construction, $1,063,000, and then Keaton King was at $1,245,688. So you have before you today the notice of intent to award to Kelcon Construction. We would have a protest period, and then the board would have the opportunity to sign the contract and process the contract for construction.
Okay, any questions?
No, I'm just glad that we are using, we'll be hopefully using a local company. I think that's outstanding, and the fact that a lot of the project is, well, it's all interior, is it not, basically, so that we can get it done this winter, so we can open it up for our deadline, our grand opening of March 15th. So that's the goal.
Getting to be a little bit of history on this. We've been talking about for a year or two now. So the vision of a stabilization center, the siting of it, how could we do it? What would we do? Where would it be? Because I remember those discussions, at the medical campus, St. Charles, or our public safety campus. So finding a home for it, and now the vision of getting an existing building redeveloped has been talked about for a while. So we're getting down to it now. Pretty exciting, and this does kind of. Do a rotation for some of our public safety and the parole and probation folks, so that's a byproduct of this also, but it's exciting to be able to move forward and thank the bidding process. I see that there was, a lot of companies involved, no bids on some of them, but I'm sure they evaluated what was going on in today's market. It's pretty interesting, and this will be a good project for a company during the winter, with interior work.
Yeah, I just wanted to note that I think all of us are glad we got to a final contract, and it was pretty close, I guess, to what we'd had as an estimate for the remodel. I think hopefully there was an issue months ago about comments made by this was the director of the health department that said we might lose funding if we didn't get it done. I think we'll not lose any funding, correct? And I think it was good, helpful to myself, and I know Commissioner Dare, to visit a number of these facilities. I definitely learned a lot in going to those, and I think as a commissioner, it makes me better informed going forward as to what you're dealing with. I hope this is as successful as the energy we've put into it, and I'm supportive of going forward with it, so that's great.
So I move Chair's signature of document number 2019-749, the notice of intent to award letter to Kelcon Incorporated for the Stabilization Center remodel in Bend, Oregon.
And I'll second it.
Okay, any further questions or comments? Okay, Commissioner Dare,
Yes.
Commissioner DeBonne,
Yes.
and Chair votes yes.
Thank you so much.
Good luck. We'll be over there. We'll be over watching it because it's anxious to see how it goes.
We're excited.
When will this, if there's no protest, when will this start?
We have some site prep to do with parole and probation folks and being able to have a location for them, but we're targeting mid-November for a start.
So roughly a month from now. Where does the parole and probation staff that are currently in this building plan to go?
We have a plan for modular structures adjacent to the existing programs building, between the programs building and the Deschutes Recovery Center. So we're working through the site prep for those modulars and that process.
Will this be like a manufactured home type building, and do you have to do one or two of those, or?
I believe there'll be 3, but they'll be joined together into one building. So, but we'll be able to have power, data tie-ins, and as well as water and sewer.
Right, right. Well, I know some of the people who work in this building. We're not excited necessarily to have to be moving out, but glad you've got a place for them. So, thank you.
Thank you.
So much.
So our next item is a consideration of chair signature of document number 2019-750. Then a lot of information there. Amendment to SunWest Builders Construction Contract. So this amendment, where's the contract itself? Has that already been signed?
It's under this.
Yeah, the contract was signed, let's see a date on it. The contract was signed in,
Finalized July 30th.
late July, it looks like. And that was contract number 2019-594. This is amending that with regard to the payment piece of it. The payment term approved in that originally one that was just for basically a placeholder was $1,500, as I recall, with the understanding there'd be an amendment as they progress through the CMGC process. And so that's what Lee has brought for you as the exhibit, is the amendment, which would change Exhibit 1 to indicate the $948,000. Exhibit A to the amendment is the line item that makes up the $948,000. The scope of work is in the original contract. It's a
Okay, yeah. So what you're saying in July, what we signed was the CMGC contract, picking a contractor, having them start the work, but without really knowing the scope of the work at that point. And then this is the scope of the work and the price of the work is this amendment.
Yeah, it's certainly the itemized scope of work. And I will note that the contract has a 30-day termination for convenience clause, which is, pretty powerful for our purposes. It tends to keep everybody playing nice and communicating with each other, so.
Okay. So open up for discussion.
Well, we had a little bit of work session, discussion on this, acknowledging that this is a construction management general contractor, kind of the opportunity to winnow in right on what the costs are, the best of our knowledge, and then savings in the project can also go back to us as an entity if the project could be done for less than this value engineering estimate at this current time.
Sure, Dare.
As I said the other day, the fact that the roof life is projected to be 15 to 20 years, and it's now over a 20-year-old building because it was built in 1997, I really feel that division number 7, the thermal and moisture protection, that's not somewhere where I want to save money. I really believe that that roof should be done now. It only makes logical sense that you do the roof and then you do the units. And, otherwise that number could explode because we didn't do it when we should have done it. So that's,
Something we can bring back to the board and look at adding, if that's the direction you'd like us to.
well, that's my, I know roofs and I know we don't want a roof failure. And, it's over the life.
Right.
And it's a small roof and it's really congested with all those units. So anyway, that's my personal opinion after building 2 houses and knowing, roofs.
Well, and I expressed the same concern at our work session Monday that to me, it's not a savings when you take out something you're going to have to do in 2 years anyway. The savings is when you change a strategy, you change a means of how you're going to do the ventilation or the heating or whatever. So I think if there was support for that today, we could amend the numbers that way. My concerns with this expressed on Monday at the work session, I've had a chance really to look at the memo that you provided on Monday, which I hadn't really read in detail before the meeting because I had just gotten it. I think the thing that's lost, and I'm going to just say it another time, is that this started as a project to eliminate a carbon monoxide problem, apparently in a few areas of this building. We were given an estimate of around 600,000. We're now talking about 900,000 plus 300,000 or more that we're buying all these units for. We're talking about $1.3 million to solve this. The original problem was the carbon monoxide, and I just I'm not going to be supportive of the amendment. I just think there's a fault here in the way this was approached. I think that as soon as we found out it was that much, we should have had a immediate meeting then and talked about what are we going to do. This is all taxpayer money. It's all fixing a building that's 20 years old. I think a lot more things should have been considered. The other thing that really concerns me about this memo, and I brought it up briefly on Monday, but I'll bring it up more now, is there's the pro and con of different options. The big pro or con is cost in each one. If you were doing it for yourself, you'd say, well, I want to do this because it saves me, $20,000, $200,000, $500,000, or I don't want to do this because it costs that much more. And it's interesting that all the pros and cons are wording like what it does functionally, but it doesn't really talk about like what the cost savings of the difference are. And that's how I think we should evaluate options in something that's expensive. Is we should be saying, well, if we do this, we can eliminate the carbon monoxide. It'll only cost us this much money, but it doesn't, replace everything we got. And so I just think we should have dealt with this sooner, and we should have dealt with it more completely with that thinking approach to the cost of a project like this. I'll also say something that I think Commissioner Dare brought it up at a previous meeting, is that the units here are 1/4 of the cost of doing this. So the big equipment we're putting on the roof is $300,000, but we're going to spend maybe as much as $900,000 getting everything done. And that doesn't maybe sound like a lot if you're dealing with big contracts of big buildings. But that's a lot of labor and materials. I mean, it's enough to build, as I said the other day, 3 houses or whatever. So I just think we should have taken a little deeper look at this and tried to solve the carbon monoxide and tried to save some of the money along the way. So
I think of it in concept of, this is the right solution for that building. There's some design issues, just the subsets of roof area to be able to work on. The design when the building was built originally had these individual natural gas units with their intakes and exhausts, so we've learned a lot about that. The double boiler system is a big project, putting in just the boilers, the natural gas to heat the facility, and then those air handler units using the existing ducting, and then now we're going to be replacing the control system, which is a generational thing also. So, we're talking about the roof, but the controls are the next big thing. So yes, I acknowledge it's a big chunk of dollars, but it's kind of the preventive maintenance, setting ourselves up for the future for a long period of time. So yeah, I'm not opposed to this at all. I really like the fact that we're working together. CMGC let's look for those savings. It did end up being over $1 million, but it is a big building and it's a lot of value out there. A lot of people working in that building also. So, I mean, we're having a great discussion amongst all of us. A lot of good, diverse opinions.
So if there's no further discussion, we can entertain a motion.
So, yeah, with that, I move. Make sure I'm looking at the right one. So approval of chair signature of document 2019-750, amending the SunWest Builders construction contract to establish a guaranteed maximum price for the HVAC system, replacement system at the Health Services Building at Courtney.
Okay, can I amend it? Because I want the roofing done now.
Yeah, you can move to amend
Okay.
the
I move to amend the motion to include the cost of, let's see, it's $66,215, Division 7, to replace that with, over the $9,175. So the roofing is done at the same time.
So, and I'll support that, and for discussion also. So we're talking about this is flat roof area, so it's a kind of a membrane roof. You think of it as a rubber surface up there. The units are going to come off, units are going to go on. So I think the area we're going to affect is the attachment, that edge of where those units are. So yeah, what are you talking now that this discussion's happening? What does it sound like?
So it would be about a 5,000 square foot. It would be the roof well, the mechanical roof well that has a single ply roof membrane. It's approximately 5,000 square feet, and then there's a much smaller, lower roof that's maybe a couple hundred square feet that would be included as well. And then the remainder of the building has a composition shingle roof that we'll look at here in the near future, but the critical portion was the single ply.
So yeah, so Commissioner Dare is showing support for that flat membrane area of the roof well you're referring to it as, and we're talking 5,000 or 6,000 square feet. So, yeah.
Yeah, so I think the amendment will suffice. I mean, I don't know that the exact dollars have to be determined at this point. I mean, it's probably be whatever they come up with once. It just seems like it's the right time to do it while you're up there doing everything else. You might be a good time to do the roof rather than try to do it after you've, because we're going to have all these pipes laying around there.
It was the original estimate on the
Yeah,
4th of September.
Yeah.
Right.
So-
So
So someone had to be looking at it, thinking that it was a smart time.
we do have pricing from a subcontractor to do the roof at the same time. So we could easily have SunWest add that back into the current itemization, and then with board approval, include that in the contract amendment.
But I do, can I make it just a comment? I do agree with Commissioner Henderson, though, over the fact that this was 4 times the cost, the $345,000 for those units. And it's now October, and it's going to be, 17 degrees tomorrow morning or something. So it's really too bad that it took so long to get to this point. And I would hope that in the future we could be part of the solution a lot earlier. So, and different options, because surely, did we have to go with 24 units? You know, there's a lot of things. It really, the cost exploded.
Well, and along those lines, I mean, you see all the big buildings going up around Bend and Central Oregon right now, the apartment buildings, the multi-story structures going up. I mean, it's amazing to have a contractor engaged and the subcontractors available at this point in time. So there's an environment out there there's a lot of big buildings going up. So for us to have this size of a project in this time frame is valuable. And I do thank the contractors for working with us in the CMG process. CMGC
I know,
process.
but now we're dealing with winter
Oh,
weather.
I know. I'm just
So,
saying, it's
It's,
a dicey time on another front, just having the subcontractor capacity in Central Oregon.
I guess what we might do is move approval of the amendment first, and then we'll,
I think Lee would need to bring back a second amendment to address the roofing piece that you've authorized, or at least
Well, I think
indicated that would be approved.
I was thinking we would approve the amendment in form, or, without the exact number, but with the concept, and then we'd vote on the contract, or, the basic scope of work. Is that all right, or,
Sure, although, it's going to be amending SunWest's CMGC piece, so that would require an additional amendment. It might be,
okay.
I don't know what the dollars, if it'll be in Tom's signing authority, or if it'll require coming back to the board.
I could offer that as an option, because that amount would be in the $66,000 range, and Tom Anderson would have the authority to approve that as a change order to the amended contract.
Yeah. From a decision-making point, I was just going to say, I think what Commissioner Dare said is that she's in favor of the overall amendment if it's amended to include that. So it seems like we would
Right, and
vote on
Commissioner
that.
Malone accepted that as his
Yeah.
motion, so it'll need a second and then a vote.
Okay.
And then, we can process that as a change order then on the roofing piece.
So do we, I guess I'm asking, would we vote on the amendment that Commissioner Dare had made, at least in spirit or whatever, and then vote on the overall matter that was on the
Good, or
agenda?
you could just, I understood her to amend Commissioner DeBone's motion, so that his motion is to approve 2019-750 with the addition of the roofing component
Okay.
identified on attachment A, and I think Lee's indicating that's $60,000 or $70,000 approximately, which,
Yeah.
if the motion included authorizing the administrator within his signing authority to sign that change order, I think that'd be the end of it in terms of bringing it back before you
Okay.
folks.
All right.
So I'll accept that amendment, so acknowledging we're taking that idea and making it the motion to approve this document in 2019-750 with adding the authority for replacing the roof. So then if you want to second that, I think we're getting there.
I will
Yeah,
second that.
There we go.
Okay. Further discussion? Commissioner DeBone?
Yes.
Commissioner Dare?
Yes.
Chair votes no. So that completes item number 8. Thank you thank you for coming in, Lee, and getting this all in front of us. Good luck with it. Hopefully it moves. Hopefully we don't have a lot of bad weather in the next month and you can get underway.
We're having it tomorrow. What do you mean?
Well, hopefully we don't. Good.
Open up the roof right at a snowstorm.
All right, our next item, number 9, is DCHS Behavioral Health Homeless Services. And whoever's going to join us on this, I think this is just a discussion, really. We're looking forward to it. I think we asked to have you come to the, so.
So I'm not the one presenting on it, but Colleen Thomas and Molly Wells are planning to be here at 11 on the agenda. So I don't know, I can certainly call them.
Yeah, we're just that quick.
Okay. Yeah, we're way ahead of schedule, I guess. Why don't you go ahead and call them? Do we have any other items or executive session items today?
We don't have any executive sessions.
We have some
Also,
holdover
we're going to
items
follow up
from-
with, I suppose, both the MPO and the wildfire both involve CDD. We could get Nick over here. I think he was planning for later also. We also had the EBAC follow-up, which we could bring Kathleen down for.
Yeah, I can text her.
I need to get my notes for that.
So just kind of other items, yeah.
I didn't bring my notes for that either.
So, yeah, the EBAC, we could finish, that'd be a great thing to finish up, because I don't know that we're going to have to meet this afternoon. So, and I did bring the notes on the MPO, so you can describe to us there.
I've
You wanna-
committed to being back in La Pine at noon today, so I'm just acknowledging that I might roll at 11:15 if we kind of commit
Okay.
to fitting.
Well,
with-
why don't you,
I was planning on, being available back at about 2 o'clock today or 1:30.
why don't we go ahead and why don't you tell us about this, or do you have it with you, or you want to read mine?
Yeah, so I didn't print that out now. I was
this is
thinking
on
this
the
afternoon we'd
MPO.
get to all this, but
Well, I don't, is there anything else we're going to need to do this afternoon? I mean, I think we'll
Yeah, so
finish
just
this up
other items.
before
Good.
noon. I think you need to be there at noon or leave it?
be there at noon.
Okay, well, we might get that.
Yep.
Get you out of here 11:30.
So the Bend Metropolitan Planning Organization, MPO, remember, is federal dollars because the city of Bend has surpassed 50,000 people. So it's a metropolitan planning, and it happens across the country. The governing body for that is representation from the Deschutes County, ODOT, and the city of Bend, plus other folks around the table, if we choose. And an MPO at 50,000, remember Bend's getting to close to 100,000. The footprint of it is kind of mandated. So over the years, it's grown out to where there's population density just outside the city of Bend. So that, a little bit of history there. This is an update to the bylaws, nothing real substantive. Basically, there's a definition over time of a seat of the Technical Advisory Committee. So the MPO board is the ODOT, Deschutes, and the city of Bend. But then there's a Technical Advisory Committee. So there's two sets of bylaws here. Technical Advisory Committee. COIC has had a seat on the Technical Advisory Committee, and then a seat was added for the Cascades East Transit, and then we found out that really Cascades East Transit is the one that want to be there. So removing the COIC seat because it really is the CET seat. So that's, on here very specifically. Bend Lapine Schools make a voting member. So this is Technical Advisory I'm referring to. So this is kind of the subcommittee of the group.
So there's a motion to, or
and
including this
DLCD.
is that Bend Lapine Schools becomes
A voting member. So they've
of the
always been at the
technical
table,
advisory.
yeah. And also DLCD.
What was the idea with
representation.
the Bend Lapine Schools being on the Metropolitan?
I think, so there's different discussion. So, some people bring in the concept of the human school bus, the routes that people will walk to school, but also advocacy for bike lanes or sidewalks. But then on top of that, it's just traffic patterns for the commute hours also. So it's really, technical advisory is just kind of laying out all the different interests. DLCD, as I say, has been at the table. So that's, kind of land use. So this is just, and what these really are aligning it to how it kind of flows today. It's not looking for the next thing, it's kind of just documenting how it's evolved over the years.
I'm just curious that, I wonder what percent at 8:30 in the morning, because I take my son to school and I see the buses, at what percent of the traffic is school buses and school kids during that deal? I mean, it's there if you have to go by a school. I guess that's would be the idea, is that it's affecting the
I was
traffic
say
at that
technical
time.
advisory is really just kind of opening up and putting all ideas out there, because then they'll come with recommendations to the board itself, MPO board. Tyler Dickey's the staff person, and a couple other
For,
folks.
Bend Lapine.
No, MPO. So, City of Bend, Tyler Dickey is a City of Bend employee, but he's, the planner and basically director of the MPO, so as a City of Bend staff. Because these are, as I say, this is qualifying for federal dollars for regional planning a little bit more. So that's,
And what's the
basically what we're doing.
LCDC role about in the?
as I say, this is, they've been at the meetings, they're attending the meetings, and, it's just kind of the lay of the land as it is now. So I haven't gone to the TAC meetings, but this is, my understanding is really aligning with who the engaged players are at that TAC right now.
Do we have anybody that goes to the Technical Advisory Committee?
Peter Russell. Yep.
Nick, do you have any, we're talking about the MPO bylaws change, and so
And he may
one
not
of-
have, yeah.
and I don't know
This
if,
is more Chris Doty world.
well, but who does Peter work for?
Oh, yeah, him, but I'm just saying, I don't know.
Have you heard anything about the changes with regard to the bylaws? It's not a big thing. We're just hearing about them from Commissioner DeBone because he attends the meetings. They're making LCDC a voting member of the
Technical advisory. Committee.
Technical Advisory Committee.
Tom shared the changes with
No, it's-
Peter Russell and me, so I've read them, but we haven't discussed them at the staff level.
Yeah,
and-
so,
What's making them a non-voting?
It's making them a
A non-voting
Well,
member.
Ben Lapine Schools and DLC are non-voting. Okay.
Well, the school isn't, and now they're switched to a voting member, but DLCD is currently a voting member. So it's,
Oh, they're reversing. Oh,
yeah, they're reversing it. So they're giving more local input. I mean, really local.
Yeah, so I was backwards on the one of them.
What, and then I saw that they're reducing the city membership. What was the thought behind that? Any idea?
So the at the MPO meeting, or MPO board itself, so there's two sets of bylaws, so that's the other one. So the dynamic is, it's 3 individual votes by 3 entities, either the county, ODOT, and the city. So the city has always been, a quorum of the city members is 2 for 3, but they end up with 1 vote. So it's just a little bit interesting dynamic. So staff usually will sit in if there aren't 3 city councilor members there. So really, it's just kind of clarifying how the city gets to a vote with their elected officials a little easier than with staff members.
Okay.
So as I say, it's kind of the way we do it today.
It was an interesting comment last night, or actually an interesting question at the State of the City. Someone wanted to know if the county paid their fair share and for running roads.
Transportation, okay.
Yes. And Eric King properly answered the question and said we were a wonderful partner. So,
Well, and that's interesting because, as I say, these 3 entities are figuring out how to spend these federal dollars. But then Deschutes County, we've got the capital improvement plan, the CIP into the future. And yeah, we're writing checks or committing to $5 million at a time, like the North Interchange, North EIS. So that's very valuable, the fact that we're able to come up with big chunks of money instead of, if we, I don't know the partnership concept that was laid out last night, but if we offered $200,000 at a time for smaller projects, $1 million will disappear real quick. So I think the value of the county's investments are big chunks of money to do bigger projects. So, as I say, I wasn't there last night, but that's what I've always kind of figured out.
So are we being asked to give?
Well, I'll
you
be
the
voting
vote?
on this. I don't know that we've ever really made it, and this is sharing with the other commissioners about what I'm representing of the Board of Commissioners. So we can formalize it or acknowledge it. As I say, I think.
When, and what are the meeting dates for?
We have it monthly. Next Tuesday is a monthly meeting,
In the morning?
midday, noon. It's in this building.
Do you have any further questions? Or?
no, I don't at this time.
Thanks for sharing it with us, and
So I'll
Sounds like
acknowledge
there-
that as support for those bylaw changes. As I say, we can formalize it if we want, or, it'll be formal when I take a vote at that meeting for those changes.
I just know that schools are incredibly impactful, and I'm glad that they're bringing the Bend LaPine School to give them a vote. So, and then I know there's all those unintended consequences from the time changes, the starts for the schools. And now, because the older kids are going later, they're not home now to watch the little kids when they get home, all those kind of problems. So,
well, it's interesting, having watched the time changes and used to be that getting kids to school was the thing that got everybody in the house up. It got a lot of people up because it was so early. They had to be there at 7:30, so they had to be up at 6:45. So, now it's different with the older kids. So, but then the younger kids still go early. It's interesting, but we'll see. I guess they think they'll perform better, but I just noticed it's a lot busier to drive around at the later timeline. It's harder to get to school and stuff because there's a lot more traffic at the 8:30 time. So.
I would think so. And some of those 8:30 people could be driving themselves. Some of the kids that drive.
Well, some are, yeah, they are. And then there's just a lot of more people driving at 8:30 than 7:30. Okay, good. Well, thanks for that update. So, do we have are we ready to talk about the homeless efforts? Okay, so come on up. I forget what we called it on our agenda. I gotta find my agenda again.
PowerPoint, you get it?
What's that?
We have it.
A PowerPoint?
Yeah, thank you.
On this side.
So thanks for coming over. We usually don't run a half an hour early, so that was a big deal to us.
Unique. It was a unique morning.
We
Health Homeless Services.
yeah, and we're excited to have you here. We just as a preface, we'd asked to have you because we're talking about homelessness in other meetings, but we really have never had a full-on report of what you see and what your experiences are. So we're excited to see you. So
We're excited to be here.
good.
For the record, I'm Molly Wells-Darling. I'm the new Intensive Adult Services Manager. So
And she came from Pendleton.
many moons ago. I came
yeah.
from Pendleton. Yeah, Pendleton, and then I was at Deschutes County for years, and then at the hospital, and now I'm back to Deschutes County. Colleen Thomas is our homeless outreach coordinator, and she is the expert on this, so she is going to be the one giving the presentation.
Holly, what's your new title? I didn't realize I knew you'd left St. Charles but
It's intensive adult services.
Okay.
So the DCDC clinic and all the services that are within that building.
okay,
Number
good.
of different
Thank you.
You all get a copy of I have a few
Yes.
extra. Okay.
did.
So,
It was in our pocket, yeah.
Okay,
yep,
awesome.
here it is.
Colleen?
Yeah. So I will see if I can pull it up here.
Is it Molly or?
Molly,
Molly.
I'm sorry.
that's okay.
Okay.
Colleen, how long have you been working on the homeless in Deschutes County?
I've been in this position for the last 5 years.
Okay, because I heard your name several times, so.
Yes, yep. Yes, so I've been the homeless outreach coordinator for Deschutes County Health Services for the last 5 years. Before that, I spent some time on the crisis team. And I also currently chair the Homeless Leadership Coalition, which is our local continuum of care here in Central Oregon. Let's see. It's been a while since I've used PowerPoint. I guess, is it this weird clicker? There we go. Okay.
Do you want me to click for you, or you?
I think, yeah. All right, so this is kind of just an overview of the homeless services that we have here in Deschutes County. We're going to review a couple different things regarding the point in time count and what Deschutes County Behavioral Health sees in regards to individuals experiencing homelessness throughout our county. Okay, so just as an overview, the point in time count, for those of you that aren't aware, the point in time count is a HUD mandate that we have in our region. The continuum of care provides that count. This past year, in 2018, throughout the count in the Tri-County area, there were 880 people experiencing homelessness. It is a count that we do one night a week, or one night in January. We count for 3 days, but we always ask the question, where did you sleep on the night of? Last year was January 23rd.
Real quick question on that.
Yeah.
I've always wondered why they do it in January or why they don't also do it in the middle of summer.
That's a really good question, and it's a question I think that we always are going back to HUD and asking why do they choose January. One of the theories behind that is that the folks that are experiencing homelessness in January are literally experiencing homelessness, meaning that if we are finding folks out in the community in January, that most likely that they have been there for an extended period of time. It's not just a one-time episode, if that makes sense. Locally, we have talked about creating another point in time count in the summer to see if there's a variation between folks that are literally homeless in January versus summer. To
Or we
kind
have
of
the traveling homeless too.
yeah. So that is, we have talked about that as a region on wanting to implement another count. There just is a lot that goes into creating a count. Volunteers, trying to get the funding to be able to create that count. This last year, we were able to do a hybrid of the count where we did paper surveys and we also did electronic surveys to hopefully get better data, more real-time data. There is some hesitation for folks in the community because of that mobile piece. The folks that are experiencing homelessness have some fear around what that could mean and then will deny being part of the count. One of the things is it is a volunteer count. So folks, even though we might be seeing them at their actual homeless camp, they can decline to participate in the count. So I always just like to preface that the point in time count is what we have for data regarding individuals experiencing homelessness, but it's only a glimpse of really what we're seeing in our region because it is voluntary.
The count, the last 2 years only had 22 veterans listed each year. So we know there's a problem with that number.
Yes, and locally, the Homeless Leadership Coalition, through our coordinated entry system, which provides services to folks that are that have high vulnerabilities, that are literally homeless, we have more folks on that list than we do at the point in time count. So there's also, we can make a lot of assumptions of why that is. What we hear from folks is they are fearful of providing information for the count because they're afraid that then they will be asked to leave where they're located. And so there's just a lot of fear around participating in that. A couple years ago, unrelated, after the point in time count, there's a big sweep at one of the homeless camps. So there's that kind of historical thought that if somebody participates in the count, they're going to be asked to leave where they're located and almost be outed for where they're camping.
I have another question about the point in time. Why does it involve both Jefferson and Crook counties? Because that seems like a huge land mass compared to, it'd be interesting if it was just focused, what we'd come up with if we just focused on our county, the resources.
So the point in time count, as I mentioned, is mandated by HUD, and HUD does that for each continuum of care. The continuum of care for Central Oregon includes Crook, Jefferson, and Deschutes, as well as the Confederated Tribes of Warm Springs. So we have to do it region-wide. I mean, there's another question, if we could do that, just focus on a Deschutes County count, but I think that the region would also want to participate in that because the funding that we do receive through the continuum of care is for the Tri-County region.
It goes into our regional assessment for the health program, so the numbers are really looked at there.
Yeah, and I would say too, so in Central Oregon, 70% of people experiencing homelessness were unsheltered, whereas the whole state of Oregon, only 64% of individuals experiencing homelessness were unsheltered. So again, this is a nationwide count where it's really an unfortunate way that they mandate us to do it because it's only a glimpse and it's the data that we use. But it is compared to different regions, different continuums, and we're comparing our numbers to New York. It doesn't really add up, but that's kind of where HUD is going.
One other comment on the January date. I think last year I did some research on the reasons for the January date, and again, it's not directly from HUD, but it's more speculation. One thing I read one theory is that another reason for doing it in the winter is people are more likely to be in shelters to be counted as opposed to being out on public lands in the summertime.
So, and that's a good point to make is that we do a full count in Central Oregon, which was a change over the last couple of years where we used to just do sheltered counts every other year, meaning that we're only counting the folks that were in shelters. We're doing those folks that are sheltered as well as the folks that are unsheltered. So sheltered is emergency shelter, and then the folks that are unsheltered.
The big number here is the unsheltered. I
Yep.
mean, that's 70%.
So that, again, that's a reflection on where we are seeing what our population is locally and where, that might be extrapolated to say that we need more shelters because our shelter beds are full.
Okay.
Keep going. All right, so a few other points in the point in time count. As I mentioned, 880 individuals surveyed in the Tri-County region. Again, it's a voluntary survey, and it's all self-reported. So I just like to make that point because this doesn't necessarily mean that the folks that identified or answered these questions might have a diagnosis that's, through the certain circumstances. This is self-reported. So 55% individuals out of the 880 self-reported as experiencing a serious mental illness. 30 reported having a substance use disorder, and 85 reported being domestic violence survivors. So I always kind of like to pull out those characteristics because a lot of people say all people experiencing homelessness have a mental illness or are addicted to substances, where really this is kind of pointing out that that's not necessarily the case, even though it is self-reported.
What we've heard at meetings is, and I've heard at other places, is a third of homeless people have or experience some kind of serious mental illness. A third have substance use disorder, and a third have other, financial or other reasons. So this is, and so even that, this is really different than that.
Yeah.
So that's
I'd be interested to
interesting.
ask those folks where they heard.
Yeah, we
about those
just,
stats.
yeah, I can't remember. We've had multiple people present, but that's what I've heard. So maybe it's, actually, it might have been from law enforcement, or, I don't know, we've had different people.
If you watch A Seattle Dying, they'll say that it's a lot of substance abuse for that documentary.
Yeah, and I definitely think, again, this is all self-reported, so this isn't really pinpointing the exact percentage of individuals, and because they can decline to answer any questions either. But again, this is the data that we have, so we have to go off of that. So you can go either side of whether we see.
But if you look
that's-
at our numbers of parole and probation, the two major categories are domestic violence, the people that are being watched, it was up to 250 a month. And, yeah, so that one does follow.
Well, the other thing that's kind of interesting is that you add all this up and you're still below 20%. So do if you ask the other 80%, they're just there because I like it? I mean, what would be their, what would they be their self-reported reason for being there? I guess aren't able to ask that question, or?
So one of the questions on the point in time count survey is what was the cause of your current homelessness? I don't know if I have those exact numbers in here, but this is something that I can get to you. One of the highest reports is inability to pay rent. And most of that, we can extrapolate that to say that rent costs are a lot higher than what individuals are able to afford. There also are different, some of the answers, I think, so it could be inability to pay rent. It could be a lot, when I was conducting the survey this last year, a lot of the answer was family asked me to leave. So most likely that they were staying with family or friends and they were no longer able to stay there, whether that was the place where they were staying, the rent agreement didn't allow them to stay there because it's not on the lease, or family just says we can't continue to have people stay with us.
But those aren't it sounds like those aren't sanctioned questions or because you're not putting those numbers in here. You're hearing that as a person that does it, but you're not,
It's
not like you have to check a box or other as, 20. You're just saying because this is 20%, but then there's 80% more. I mean, those both make sense.
Well, so in these questions or these characteristics are they are what we call specialized populations, and so those are when we report to HUD, they are a separate entity that we report on.
These three that you have on your okay.
Yep. The question that we asked on the survey in Central Oregon is a question that we've added of what caused this period of homelessness. That is not a mandated question from HUD for the point in time count.
It's a great question to have, though.
Yeah.
If we could get the answer for that, that would be really helpful.
And I can also provide you with the survey that we actually use, because in Central Oregon, we have opted to ask additional questions that we can use locally. So we do ask questions and try to collect data on folks that are precariously housed. And that's not a question that HUD asks because they only want to know who's literally homeless. But we have a high population of folks that are precariously housed, and that we have a great relationship with FAN, the Family Access Network, where most of the folks that they're serving are precariously housed, meaning doubled up with families or couch surfing. So I tried to break out a little bit of the Deschutes County point in time count report. So as you can see, 633 people were surveyed just in Deschutes County. Of those folks, 22% of respondents were chronically homeless. And so I want to pull out that chronically homeless under the HUD definition is really convoluted. And so to be identified as chronically homeless, the individual has to have 12 consecutive months of being literally homeless, or 4 or more episodes of homelessness that total 12 months over 3 years, and you have to have a disability. So that's the HUD definition of chronically homeless, and 22% of the respondents in Deschutes County were identified as chronically homeless.
Okay, 12 months over 3 years, or
12 consecutive months.
You did the math on 22 times.
Oh, I was going to do that next. I had to write down all our other rules. This is like, oh.
Yeah. So yeah, 12 consecutive months or 4 or more episodes over 3 years, totaling 12 months.
So that's like 139 people.
Okay, so some trends that we are starting to see in Deschutes County of folks that are experiencing homelessness in the last few years are family and working class individuals, migration from other parts of the country, unaccompanied youth, and individuals living in RVs and other vehicles where with nowhere to park them. I'm sure you have all heard of that. So just as an example, I hear a lot of folks that are migrating to Bend because they hear that we have a lot of jobs available. And so folks are coming here with the hope of finding work, but aren't doing the research necessarily on our housing crisis and are ending up on our streets or in our homeless shelters.
So your last point about the RVs and other vehicles, so are all those, like out there on Hunnell Road and stuff, is that all counted as, during your count, anybody that's in a RV or a whatever, living out of a vehicle or anything like that?
So someone that is living in a vehicle is considered literally homeless. It gets a little convoluted with the RVs. So if in a round way of saying it, if the RV does not have access to hookups, meaning water, sewer, electricity, then that is considered homeless. If they have hookups, then they are not considered homeless. If they're paying rent, so like on somebody's property, then that's not considered homeless.
But all the ones you see quite a few on the streets in Bend now, and certain streets specifically, so they're not using the sewer there or septic there. They're not using water from there. They're bringing all that in. They have a generator maybe to keep their batteries up and stuff like that.
So they would definitely be considered to be experiencing homelessness and would be a part of our count.
That was like this morning driving in on Friar Road. There's a new facility you can pull in with your horse trailer and go riding, and there was somebody parked there this morning really early. So I was thinking like, okay, they found a spot to park where it's, out of the way.
And in the long run, I think that a lot of individuals feel or have the assumption that it is cheaper to potentially buy an RV or some kind of camp trailer. The problem that we see is that there is no place to park them. Our RV parks are full, or the cost to park in different locations is pretty expensive. There are some different RV locations that they're maybe the higher end, but they have certain limitations. They want an RV or trailer that's new within the last 10 years. And a lot of the folks that are purchasing these vehicles, they're not brand new. So it's tough, and so there's nowhere to go, and then they end up on our streets or on our public lands.
Our county RV park at the fairgrounds, isn't there a rule on how long you can stay there?
Yeah, and that's the other thing, is there's limitations, and so it's a Band-Aid for a lot of folks, but it's not a solution.
Good.
So just a couple different data points as poverty in Deschutes County. We will be having the new census coming up, but this is what we have to go off of. There's a significant number of Deschutes County individuals live below that federal poverty line. As you can see, 21% in La Pine, 15% in Sisters, 20% in Redmond, and 12% in Bend. I'd be really interested to see what the numbers are going to be coming forward. I think we're going to see an increase in the folks that are experiencing poverty. And so, we can make the assumption that a lot of those folks that are living in that poverty, below the poverty level, are either at risk for homelessness or experiencing homelessness.
Do you know Colleen, do you know the exact level? Are we talking a one-person federal poverty level, or, sometimes they say family of 4, it's 58,000?
I believe it is based on one person.
One person? So it's like
Individual.
less than 20,000 or something, it looks like?
Well, this numbers are in the incorporated areas.
Yeah.
So, this is, 2/3 of the population. There's a lot of unincorporated areas too.
So moving on just to kind of our realm and the Deschutes County Behavioral Health section of what the county provides. We went through and kind of did a little data pull. And so there's 381 individuals that were identified as experiencing homelessness across all Deschutes County Behavioral Health clinics. That means that somebody that is engaged in services with the behavioral health team. How we gathered that data is we went through, I won't really go into all the nitty gritty, but went through the last 3 months of progress notes for those people engaged in services, and they had to have so many different words related to homelessness in their progress notes. And so that is the number that we came up with. I would assume that it might be bigger than that, but that is the number that we have for right now. So, homeless outreach for Deschutes County is my position. It's called PATH, Projects and Assistance for Transition from Homelessness. It's a state-funded program through SAMHSA. And the target for that grant is to serve folks that have a serious mental illness and are experiencing literal homelessness. So I always like to put out that literal piece because under HUD's definition, that doesn't include folks that are couch surfing or doubled up. So it kind of is a very specialized population.
Why doesn't couch surfing or, as you said, doubled up, why doesn't that qualify?
Because it's considered sheltered. They have a place to be, and whether they are choosing that or not. It's, again, it's a HUD definition, and so we're trying to focus really on a vulnerable, like the very vulnerable population of literal homeless folks. So PATH, it is myself as one full-time employee to do outreach to all the county for folks that are experiencing homelessness. And part of my role is to provide direct outreach to folks, provide case management, skills training, help folks obtain entitlements like Social Security, health insurance, birth certificates. We just recently got a grant last year to help folks that are from the state of Oregon that are experiencing homelessness get their birth certificates so then they can obtain other entitlements. I provide drop-in times at different local shelters, meal sites, and am out in the homeless camps across our region trying to connect folks to engage in services. A lot of the referrals that I receive are from community members, BLM. They're really they have my number on speed dial. The police department, school districts, and it's really just trying to provide as much outreach and coordination with our community partners to be able to connect with those folks experiencing homelessness and provide support and kind of wrap around them to make sure that they have the services that they need.
The BLM officer I'd met a couple of months ago at a homeless meeting said he spent 90% of his time dealing with homelessness people.
Mm-hmm.
Yeah.
You described this PATH program to provide service to individuals with serious mental illness, but at least under self-reporting, only 6% of the people that are homeless are experiencing serious mental illness. So are you having to, is that your first interaction, is deciding what their mental health status is? And if they're not experiencing mental health issues, you don't help them, or that program's not, I mean.
So that number too, I just want to remind you that that's a self-report. So some folks that are might be experiencing a serious mental illness might not consider themselves to be experiencing a severe mental illness, and it's not the first thing that they're going to share with you in some cases.
But so in your job, is it your first thing? I mean, there are people that are choosing to live this way for other reasons, as you said. So is that your first, like, fork in the road, so to speak, or?
My first role is to build a rapport with these folks and to identify what are their immediate needs.
But regardless of why they're there.
Regardless of why they're there.
Because you said, when you're doing that, are you outside the PATH program? Because.
So I'm not going to come across somebody and ask them if they are experiencing or hearing voices.
And so it's more.
Yeah, it's I have a little bit more finesse, I hope. So what the role is, if somebody is needing help, I am not going to turn them away just because they don't identify as having a severe mental illness. There are many different programs and individuals across our region that can provide additional services to folks. So I am sitting down with somebody, if they're willing to meet with me, and kind of go through a review of what their current situation is. And if we determine that they aren't experiencing a serious mental illness, I will provide a warm handoff to somebody that can provide that services to them. I do carry a caseload of about 60 individuals, and that is not to say that all of them have an SMI diagnosis. And why we use the SMI is because it is a little bit, it has a little bit of flexibility in there. I can make the assumption that most people that are experiencing homelessness have some kind of trauma associated with their current situation. And so if they're really needing support, then I'm going to provide that support to them. Does that answer your question?
Yeah, it makes it understandable.
So there are a lot of other folks across the behavioral health team that interact and provide services to folks experiencing homelessness that might not have that SMI diagnosis. So across the board with behavioral health teams, when they're working with somebody, they're going to make the appropriate referrals. And some of those referrals are to our supported employment program, housing programs, different groups, WIC, Mosaic, the integrated health programs that we have. That's always a good referral to kind of provide that wraparound service. All Deschutes County behavioral health clients are trained in trauma-informed care, and so part of that is how do you interact with somebody experiencing homelessness, and how do you not re-traumatize and have them retell their story. A lot of the questions, again, is to if somebody is if a client that is experiencing homelessness is in crisis, the crisis team does a wonderful job about being able to ask what are their basic needs and to address that so they don't exacerbate their current crisis. Always the long-term goal is to get somebody connected with housing, but as we know, the housing crisis that we have here is really tight, and so it's an ongoing process to work through that. So we also, not only do we, does behavioral health staff refer folks to internal programs, but we also coordinate and work really closely with our community partners, including shelters, food sites. We connect folks to get other entitlements like food benefits. We coordinate with parole and probation. There's many different services that we try to work with. We connect folks with Voc Rehab, Central Oregon Veterans Outreach. They are also a big partner for us, Cascade Youth and Families. They do have a street outreach program working specifically with folks that are under the age 21 that are experiencing homelessness. I will say, just as a note on this, the cold weather shelters across our region, every city has a cold weather shelter up and ready to be prepared for the winter season, except for Bend. We do not have a cold weather shelter this season for Bend. We do not. We are working on it, but we do not have a designated location.
Are you working with
Sagewood Sanctuary? Yes. Yeah. So we do the state of Oregon Housing Community Services is providing the Homeless Leadership Coalition, our continuum of care, with some funding to provide warming shelters. The problem that we're having in Bend is a location.
So it's almost winter. What? I'm
gonna be 19
surprised
degrees
with that.
Yeah,
What's that?
It's gonna be 19 degrees tonight.
Yeah.
that is incredible.
Yeah, I've always been, the last several years I've kind of heard that. And last year, I know didn't Pfeiffer Associates open up their space. I know we gave some money during the middle of the winter for that. And I'm surprised there's not somebody planning this.
So the Homeless Leadership Coalition has a shelter network, and we are working on trying to identify a location. Sagewood Sanctuary did provide the shelter through Pfeiffer and Associates last year, but due to some circumstances, that is not an option this year. Most of the churches that we have approached in regards to a location have declined that at this time. But we are working as a continuum to create an opportunity. We're going to be working with the Red Cross potentially to create a training for volunteers, because that's a big piece of working with this population for a no barrier warming shelter.
What about the fire station out on, I think, east side of town that's empty? Does any, I mean, it's not a county building, but.
The Neff Road one, yeah.
Yeah, but there is that building.
Well, that's a good idea. I will bring
Anyway.
that back to the committee. Thank you.
Good.
Yeah,
Is
so
that
we are
one of
looking
the-
at different locations.
Is that one of the issues, is the barrier, you mentioned no barrier, so is barrier, I think it's drug or alcohol related, right? That
The
you,
low barrier, means that there's somebody that can access the shelter under the influence of substances.
is that the challenge with the Sagewood Sanctuary, is the barrier issue, or is that something else?
I think that's, I think there's a couple different issues along with that. I think that this is a very vulnerable, high-risk population, and if you're providing a no to low barrier shelter, you need to have experienced, trained volunteers to provide that service and oversight for that population. And unfortunately, we just didn't have that last year going into the shelter. So we're working on trying to create that, a streamlined process for across the region. The other thing is, as you know, each city is different, where Lapine will only open their warming shelter if it's 0 degrees, but we're 30 degrees, and Redmond is 32. So trying to work with each community to come up with a streamlined process so that we can have it's easier for clients and service providers.
What's Sister's temperature, do you know?
I think last year was 10 degrees.
I know someone froze to death a couple years ago.
Yep.
But
And that's what
people offered
implemented.
him. Yeah, people offered him, and he didn't accept it. Yeah.
All right. So another program that we have throughout the behavioral health system is our young adults in transition. They work directly with youth that are experiencing homelessness as well. They provide the drop. They call it the drop, which is a drop-in center right over here at the Wall Street building. They provide laundry facilities, hygiene products, sleeping bags, and things like that to really engage that younger population and have a safe environment for them to be in. It's been a great opportunity to connect with some of the younger folks and help them connect to other resources. So, we have a lot of community partners across the region really try to provide a coordinated effort and to address, the issue of homelessness in our region. It's never going to go away, but we want to make sure that we are providing those resources that we can to those folks. So, just some of the different ones. It's kind of just overview of what, there's many different aspects to homelessness in general. So if you guys have any questions, I'm happy to
Questions?
answer.
Just acknowledging, Bethlehem Inn has been redeveloped. It's found its, home, its permanent location. It's been a long journey on that, so the facilities have been redeveloped. But the difference between Bethlehem Inn and Shepherd's House is that kind of the barrier level that it's set at. Shepherd's House tries to do a long-term program for folks that are ready for that, but they are kind of a lower barrier place for people in need, but they get overwhelmed because I've communicated with those guys also.
Yes, we desperately need a low barrier year-round shelter in our region. Bethlehem Inn is great, but it is a high barrier shelter, meaning that there's certain requirements for folks to access that as a resource. So.
And this is a big picture of community issue we all need to struggle and wrestle with, so.
And it's only increasing, so
Yeah.
I think that we'll see, with this count coming up in January, where I have a feeling we'll see increased numbers, but again, that's just a glimpse of the larger population.
So do you need something from us? I mean, you've been doing this for 5 years now. It's not getting better. The numbers are going up. Is there anything that we can do to help you?
Oh, you're opening Pandora's box here.
Everyone talks about
Yeah.
it.
Well,
Everyone
I think-
talks about homelessness, and yet I was working on it in the 1980s, and it's just, you just see the trajectory. It just keeps going up, and so, and you definitely see it, and you're only one person doing this incredible, the rapport, which is so critical.
Yeah, Thank you. I think, one of the things that I see, so as I mentioned, our Homeless Leadership Coalition, which is our continuum of care, there are 7 continuum of cares in the state of Oregon. Our Central Oregon, so with the exception of our continuum of care, all the other continuum of cares are funded partially by the counties. I don't know what that would necessarily look like, but I think that, when we are talking about individuals experiencing homelessness and wanting to provide more services, we don't have the funding there to provide those services. There might be grants that come out from the state for brick and mortar, but I know the county, we aren't in the business of building housing, but we can provide services. So if there's opportunity for service dollars to provide more outreach besides just myself and, the folks on the young adult team, I think that is always something that we're looking for. As I mentioned, I carry a caseload of at least 60, and there, as you saw the numbers, there's a lot of folks that are experiencing homelessness, but we don't have the services to really meet each of those individuals out in the community or where they are.
I remember there are 147 children on the count with parents. And that's like a group of people that I really believe if we can get them so that they don't think that is the way that your life has to be, to target them and get them out of that spiral, that downhill spiral. I know that like Friends of the Children, if they have someone that's possibly going to go homeless, they actually can make calls to people to, help them, but we've really, we've got to step it up for those kids.
Yeah. Yeah.
What, I have a question about, so you said, a caseload about 60, so is that rotating? So do you have 10 new every year and 10 that,
It
that you,
fluctuates.
or how do you, what's your impression of that?
I've had folks that I've worked with since I started in this position. I think.
What does that mean? I mean, 5 years, your job is to make them, I think, not homeless.
The goal is to.
That would be that. So 5 years later.
Yeah, the
You're
goal is
still
always,
working
of
with
course, to have somebody not experiencing homelessness.
Yeah.
I think that there are definitely different circumstances. And when you look at the population, you can't. I'm a strong believer in not doing a blanket statement for all those folks. You have to treat everybody as an individual because their experience is different. The individuals I'm thinking of that I've worked with over the last 5 years have been in the process of applying for Social Security disability, and that's an ongoing process of appeals and different things, and they are unable to provide or obtain that income to then find housing. They are in and out of shelters when they are able. Substance use also plays a part in that, and it is a cycle. Some of the other folks, and again, I don't think I am somebody to say what a home should be for somebody. I have folks that have created their home on BLM land or somewhere out in the woods, and just because it doesn't have 4 walls, a roof, and running water doesn't mean it's not a home to them. So, but they're still experiencing homelessness. So I still provide that outreach and make sure that they have access to their basic needs.
The people that settled this country lived that way. It wasn't, everybody didn't have a apartment with, 2 bathrooms and 3 bedrooms. I mean, they, the whole, it seems like there's kind of a return, almost a return that way to just simplicity of living or something in some cases. I know people that have chosen really to basically not work and not, just to make their life simpler and like you're saying, but it is their home. It's kind of like the RVs have now become, people like them because they can move them, they can, the fact that they don't connect to services, they solve that other ways, but the fact that it's compact, movable is really gives them a lot of control over their world. They're pretty happy with that, is my impression.
And I do like to note too, you have different cities across the nation that have said that they've solved homelessness, and that isn't necessarily the case that there's no one experiencing homelessness. What that means is they've reached functional zero, meaning that they have enough services to be provided to those folks that are experiencing homelessness. But they're not choosing to accept those services. But there's services and resources available if they're willing to accept those.
So What are a few of those cities? Because I saw San Francisco put boulders on the sidewalks
Yeah.
the other day, and then the boulders were pushed off into the street.
Um,
What cities do you think really have got a handle on it?
I think there's some in Salt Lake. There are they have the Housing First programs, which we're trying to get a Housing First program here locally through the Fuse Central Oregon. I think there's also one in Texas, one city in Texas.
Which city, do you know?
I don't remember which city, there's just an article on it.
Yeah.
Within the last couple of
I
weeks.
apologize, I'm going to excuse myself. I made
Okay.
a commitment in Lapine at lunchtime
Okay.
today. Good
Well,
discussion.
I'll try.
Thank you.
Yeah, I just was, because I just want to find out what, everyone is talking about it, but what is it we can do?
So again, I think it's providing those services. A big piece is if we were able to have a permanent supportive housing first program. So meaning that we have a program where individuals can access housing no matter what their current circumstances. They don't have to have income. They don't have to be clean and sober. But we're providing that housing opportunity for them so then they have that basic need met, and then we can address some of the other things if they're willing to.
That's kind of like the East Lake program that they did a long time ago in Seattle.
Yeah,
Yes.
there's quite a few.
There were no standards there, and you could go in, and I think they've only had one murder. So,
And I would,
yeah.
I would say
One.
too, and I think that there's a lot of work being done to provide, as I mentioned, Fuse, it's frequent users of services engagement, Central Oregon. They've done some tours of different places in Eugene and Portland, Seattle, of these Housing First programs. In Central Oregon, we only, I hope I'm not going to misquote this, I think we only have like a handful of permanent supportive housing beds, meaning that those are folks that can automatically get, or not automatically, but be prioritized to get housing without having those other resources available. And we are one of the lowest across, in the state of Oregon and across the nation for permanent supportive housing beds. Through our coordinated entry system, we do a survey called, an assessment called the VI SPDAT, Vulnerability Index Service Prioritization Assessment Tool, where we are trying to gauge vulnerability of folks that are experiencing literal homelessness. And the goal is to prioritize those that have high vulnerability and to house them first through our programs. The percentage of folks that we see that meet that permanent supportive housing level, for the amount of folks that identify in that category, and I wish I had the stats for you, and I can always provide them, but we do not have the beds available to meet that need. So we're placing folks that meet a permanent supportive housing level in rapid rehousing, which then is only a temporary program. So we're placing people into housing for 12 months, and then we're putting them right back out onto the street into homelessness because they don't have that next step to permanent supportive housing.
12 months in a home, and with all the other services, it's not possible for them to transition back to working and things if they're.
That's the goal, but we don't have enough service providers to provide that service to help them.
To make the transition then.
Correct.
Okay.
All right. Well, thanks. This has been a great presentation, really helpful to us to understand it. I remember I went to, there was a big Housing First conference, I think it was in 2017, that I went to, and I didn't know what's going on, so it's good to hear. We're
Well, if
still
you ever
working
have
on
any other
that.
questions, always feel free to reach out to me. I can talk about this forever, so.
Yeah, thank you.
Thank you so much, Colleen.
Thanks.
Thank you.
Thanks, Molly. All right.
Thanks, Molly.
That's a great catch-up. So we were going to do the EBAC, but with the Commissioner DeBone gone, it didn't seem like that would make a lot of sense. It's not pressing today, right? These changes are coming in for the 2020 contract, right? Right.
If the board was ready, we would accept staff direction. Otherwise, we'd come back a little later this month asking for staff direction on it.
Well, I think we got halfway through your deal Monday, but Commissioner DeBone had to leave early, so it didn't make sense to, probably because it's informational, to just tell two of us. So maybe we'll do it next week on Wednesday when we have all three of us back, because we don't have a meeting Monday.
Do we have one Tuesday, Sharon? We have one
Yes.
on.
Oh, maybe we'll do it on Tuesday then. Yeah, that'd be good. Because it's kind of complicated to follow your things, so I'm sure Commissioner DeBonne would like to hear you explain it, as it's hard to read it and understand what you're saying, or what's going on, so, so that'd be my suggestion. Is that all right with you?
That would be
Commissioner?
excellent.
Yeah, on this Tuesday. So thank you for coming. I thought he was going to be here till 11:30, so we might have gotten some more in, but, and then it looks, Nick, you're here for, okay. So come on up. This was the issue of having an additional person or not?
Yes, Commissioners, Nick Lelak, Deschutes County Community Development Director, and Zechariah Heck, Long Range Planner. We're staff to the Wildfire Mitigation Advisory Committee. The Board of Commissioners appointed 13 members. One member, when they received the schedule and the commitments, recognized that they were not able to participate. That's Glenn Arndt.
Right.
A resident. So we just wanted to visit with the board to see if it's okay to proceed with 12 members, or if you wanted to consider an alternate member to appoint. And we have a list of the candidates if you're interested, if you brought those, or however you'd like to proceed.
I didn't bring mine.
Yeah, they have lists.
You can bring it. My feeling was I'm good with starting with 12 and seeing how it goes. I'm going to be at that. There's a big forest tour I'm doing Friday that a lot of the people involved in this are going to be there. So I thought, well, maybe I'll run into somebody that I come back and talk about. But I didn't have in my head somebody that was to make up for somebody, so to speak. Did you have somebody you were a advocate for, or somebody?
I mean, 12 is good.
It was just really somebody from that citizen area or homeowner area that we would
So-
replace with maybe, but
So we have Martha is on, and Jeffrey Reynolds, they're both on. So it just would be a third person.
Mr. Art had an experience, I believe he was a retired Oregon Department of Fish and Wildlife employee, so he brought that experience to the table as well. Raymond, just mentioning a few information I know from the application pool. Raymond Meow is part of the Project Wildfire Committee, homeowner.
And he was at the fire meeting, the homeowners fire meeting I was at
Oh, yeah.
2 weeks ago.
well, he's on the board of the Rural District 2, too. He's the one that ran against Ben Schmoller.
Okay.
So I know him and Jim Powell. I just didn't think they necessarily added, I don't know. I guess I'll just stay with what I said originally, which is there wasn't anybody I felt a need to put on, and I didn't necessarily feel like we had to get to 13. Although we may come up with somebody. When's the first meeting?
Next Monday?
Monday.
Okay. It's probably fine. And in case anyone else has to drop out, then we'll start getting nervous.
Okay,
That's good for today.
sounds good.
Thank you.
Yep. What times are your meetings?
3:30 to 5 or something, is it?
Or they start at 4 Monday evenings. First one is on the 14th, 4 p.m. until 6:30 here in the Barnes and Sawyer room, and then they mainly go every other week, but there's a few weeks due to holidays and whatnot that we're doubling. We have back-to-back meetings, so the first two are October 14th and then October 21st. There is a project-specific website that has the list of the schedule. That's deschutes.org/wildfire committee. And of course, you could reach out to Nick or I for additional questions or.
Yeah, we might want to have updates periodically
Yeah.
about where it's going.
Absolutely.
Okay. Good, thank you.
Thanks.
Thank you.
Any, anything else? All right, then I guess we'll adjourn today's meeting. We won't have a follow-up this afternoon. And our next meeting is this evening in Lapine at 5 o'clock or 5:30?
5:30.
But their meeting starts at 5, right, or something?
It's there.
Okay. And are we supposed, are they providing dinner? Are we supposed to eat before we get there? Okay.